let's talk about the different types of bladder pain. So recently I've been talking about cystitis-induced bladder pain called COVID-associated cystitis. Cystitis is anything that is irritating the lining of your bladder. Now there's overactive bladder, there's interstitial cystitis, which is a non-bacterial cystitis. IC is a pain like a bladder infection without the infection. And then there's bladder infections. So with women, we don't get a lot of education on what normal bladder habits should be. So I'm here to tell you, staying hydrated matters. I know that some people try to go to the bathroom less because they want to pee less. So their thought is if I drink less, I'll go to the bathroom less, but that's not helpful for your bladder. Some people are really sensitive to preservatives, artificial sweeteners. By patients that have interstitial cystitis, they will tell you there are certain foods that are triggers that irritate the lining of their bladder. That bladder mucosa, for them, mast cells make up lots of grumpy spots called Hunter's ulcerations. And if they consume things like strawberries, spinach, pepper, lemon, alcohol, food that has like lots of preservatives, irritates the lining of their bladder. What's interesting for some of my most sensitive patients, they can have one bite of one strawberry and have residual IC pain for 7 days. A lot of these women swear by baking soda and water to help neutralize it or pre-leaf. Then there are the women that have an overactive bladder or have urinary urgency because, well, maybe they conditioned their bladder to go because they didn't want to leak. So every time they passed the bathroom, they went. Then every time they thought about it, they went. And then their bladder became quite irritated and the nerves of the bladder, so it's not sending you the correct signal of when you need to void. Overactive bladder can be treated with medications, physical therapy, and behavioral life changes. Interstitial cystitis can be helped by medications, food, behavioral changes, physical therapy, a host of things. Bacterial infections, which is the cystitis and bladder infections everybody knows, we absolutely need you to see the doctor because you feel like rubbish and you, odds are good, need an antibiotic. Now, some of my patients have sworn by D-mannose, and these are usually my women who have IC and constantly think they're having a bladder infection, but D-mannose is a lifesaver for them. But now we have COVID-associated cystitis, and all those things I said, I'm not so sure that those things fix COVID-associated. We don't know yet. But what I do know is when people have bladder pain, a heating pad on the abdomen, mindfulness and meditation, and staying hydrated is things that all people can do to help your bladder stay calm, because it does have a nervous system that is a little bit sensitive when you've been in chronic pain. So heating pad and breathing, and hit the plus sign and follow for more women's health and wellness tips. Bye.